I'm joined tonight by Sean Sheehan, who's a senior policy analyst with the Department of Vermont Health Access, and my name is Zach Goss. And we are just trying to get this information out to you, to customers, to stakeholders, to other Vermonters, so that you are aware of the benefits that are available to you through the state of Vermont. So one of the things that we want to kind of touch on today is both about the benefits available through the American Rescue Plan Act and the increased financial help that's available, but also many people took advantage of a COBRA opportunity that the federal government put in place around the same time. And we're going to touch on that because there are some important changes happening within the next 15 days or so that will cause folks to really need to kind of reconsider their options. So to start, I thought that, Sean, we could introduce just with some brief examples of how the American Rescue Plan Act, just to review how people may be saving more money on their health insurance since these new rules were passed.
Yeah, that sounds great, Zach. Thanks, and great to be here again on this fifth town hall. As we've done with the last few, we've done a quiz, done a bunch of questions in some of the past town halls. Just have a single quiz this time, but it's wordy, so I'll give folks a minute to read that. And really, what it's getting at, as you just referenced, Zach, is that with the American Rescue Plan, the piece we've been talking about is that, number one, it gives financial help to a lot more people in the form of tax credits to have lower monthly premiums. Many people who didn't qualify for financial help before because their income is too high now qualify for lower costs. People up to $94,500 who are in individual plans, people in family plans, up to over $250,000 household income now are eligible for help. And as we've talked about, there's two ways that people can take that financial help. Number one, they could call Vermont Health Connect, and or they could log into their online account and they could request that those tax credits be applied as advance payments, which means they pay lower monthly bills. Or if they don't do anything, as long as they're enrolled through Vermont Health Connect, which is the state's health insurance marketplace, they will get a larger refund when they file their federal taxes next winter. So people don't have to do anything except be enrolled through Vermont Health Connect and continuing to pay their premiums. But looking at people who did choose to take that new financial help as a discount, we're curious how much less they were paying for their September premium compared to their April premium. The reason we chose these dates were the system updates went into play in early June. So April would have been before people were getting the new discounts, the new lower prices, and September is when they could be paying a lower price. Actually, they could have in August as well. But anybody who requested to have their new financial help applied as a discount up until August 15th would take effect in September. So looking at all those people, what they paid on average in April, how much less are they paying in September? Show of hands, how many people thought 10%? Fortunately, that's not right. 25%, no, that'd be a pretty nice discount, but it's actually 50%. So that's really significant. And when we're looking at in terms of per plan, per household, generally, people have a plan. In April, they were paying about $326 on average. In September, $161 for that plan. So actually slightly less than half, a little bit more than a 50% discount. Same thing, if instead of looking at per plan, which generally would have, could have one person in it, but could have two or three, a family, per person was $231 on average in April, $112 in September. So we're talking about a really significant discount here that people can apply. And the great news is going to continue into 2022. So people will be able to get those lower prices in 2022 as well. But as you referenced, Zach, we're here to talk about 2021, and it's still relevant for people who don't have insurance yet. They can sign up through the end of the special enrollment period, which is October 1st. And it's also, as you referenced, our theme for tonight is particularly relevant for people who have been getting the free COBRA benefit. As you referenced, we've talked a lot these last few town halls about those main three provisions that impact the health insurance marketplace. Having that higher threshold to qualify for lower costs if you enroll through the marketplace, Vermont Health Connect, number one. Lower costs for people who already were getting subsidies, number two. And then number three, people who had any unemployment compensation having even lower costs regardless of what their household income is. We've talked a lot about those three provisions, but another provision in the American Rescue Plan said that people who are getting COBRA, and COBRA is continuing health coverage if people either are laid off from their job or or leave their job, as long as they're not fired or leave on their own, can have the option under federal law to continue to have their workplace health insurance. But usually it's quite costly because you're responsible for paying all of it, potentially a bit more, 102%, I think it is, with that extra couple percent being the admin costs. So it's really pricey, but the federal government from April through September was paying 100% of those costs. So it made sense for a lot of Vermonters on COBRA to stay on COBRA. But now, as of after this month, probably right now, getting the bills for their October premium, and with that subsidy gone away, could be quite expensive. And so they have the opportunity, if they want, to end the COBRA coverage and come over and sign up through the marketplace, potentially qualify for those much lower costs we just showed. And I think for where, just kind of end on this slide here, and then we can get into any questions that are up there and talk a little bit more about the COBRA benefit. But a great place for people to start, Zach, is to go to vermonthealthconnect.gov. This is what you'll see. A few pieces to look at. The plan comparison tool has an icon there of a shopping cart. You can click on it. It'll walk you right through to see what what those estimates are. Depending on your income, you might be paying a lot less than those average figures we just had in the quiz. Or if you have a higher income, maybe you'd be paying more than those average costs, but hopefully still paying a lot more than paying a lot less than you would in the spring. Hopefully less than you'd be paying on COBRA or on your own as well. Second link is that American Rescue Plan Act. That's what we've been talking about. There's a lot more information in there for people, whether they're interested in coming over, if they're direct enrolled from their issuers, they want to come over and take advantage of these lower costs, tells them how to do it. People that don't have health insurance, says what you can do as well. People who are already enrolled through Vermont Health Connect, people that have COBRA, all of those instructions you can find by going to that link. And finally, if you just don't want to deal with websites and information there, we have options to help you out as well too. You can call the customer support center. They're open from 8 to 4:30 every weekday. The phone number right there, 855-899-9600. It's a toll-free call. We also have in-person assisters. Zach, I don't know if you want to talk a little bit more about the in-person assister program and how people can get help in that way.
Thanks, Sean. Definitely. So the in-person assister program is a fantastic program of people situated within community organizations and provider organizations throughout the state of Vermont. And in most cases, there's one relatively close to you. The idea behind the assister program is that you can actually go and meet with them one-on-one, and they can help understand all of your paperwork, all of your questions, and help you clarify anything that might be unclear to you, so you can make an informed decision. And what's nice about assisters is that, you can establish a relationship with them where you can kind of continue working with them beyond that one-time enrollment or change. So, really exciting program that we have here in Vermont. The other thing that I wanted to just not forget about was I see that our attendee number has ticked up. So I just want to reiterate that if you have questions, please send them in the Q&A box, which is, there's a question mark on your screen. You should be able to click that box and type in a question. We're going to try to get all the questions during this town hall event tonight. But if not, you can always contact our customer support center or email our inbox. But yes, please use the Q&A button at the top of your screen, or it might be at the bottom of your screen, depending on your interface. So Sean, I just to kind of bring us back, I heard you talk about 3 really important dates that maybe just to kind of reiterate and clarify for everyone. So, we've got not necessarily COBRA ending, the COBRA benefit ending, but the end of the federal subsidy for COBRA ending, as well as the end of the COVID special enrollment period that is happening within the next 15 days here or so. Do I have that right?
Yeah, you're absolutely right, Zach, and those are the key dates. That this being September, this is the last month that the federal government is paying for that benefit for people who have COBRA continuing coverage, and as you say, October 1st is the last date of the COVID special enrollment period. It's been running a while now. I mean, to back up for people who maybe aren't as familiar with the state's health insurance marketplace, is the marketplaces typically have an open enrollment period in late fall, and you sign up then, you start your insurance plan for the next year. If you miss that open enrollment period, you generally have to wait till the next year before you can get health insurance. There's a few exceptions. If you have a life event, if you get married, if you move into the state, if you've had insurance through your employer and then you lose that insurance, or if you'd had Medicaid and you lose Medicaid, so there's various ways you can get a special enrollment period. But for most people, if you don't sign up during the open enrollment period, you're out of luck. And because of COVID, because of the public health emergency, because of everything we're kind of experiencing and people really understanding how important healthcare is, how important having health insurance is, that the federal government encouraged, and Vermont followed suit and actually extended even longer than the federal special enrollment period to allow people who don't have health insurance to come in. And because of these benefits we've been talking about with the American Rescue Plan, many people who might have looked, say, last fall, and decided that health insurance cost too much, that they couldn't afford it, so they were just going to go without health insurance. Well, they were looking at those numbers like we were showing before the American Rescue Plan, before this new financial help. So with the new financial help in play, had to make that time available for people to come back if they thought health insurance was too expensive in the past. Give folks time, get the word out to come back and see what it costs now. And so this is really that opportunity, but this opportunity ends October 1st. So for the next couple of weeks, people can come, they can look at the plan comparison tool, they can see how much lower health insurance would cost now than likely it cost when the last time they looked a year ago or a few years ago, and they can sign up. And one thing to point out, Zach, actually, is for people who are losing their COBRA subsidy, who have been having COBRA, they actually, if they miss October 1st, they can come in after that because the rules have been changed in Vermont to create a special enrollment period for people who had been getting COBRA, and whether they were getting it subsidized by the federal government, as in this case we've been talking about, or sometimes employers will pay. COBRA lasts for 18 months, but an employer, to help somebody out when they're laid off, might offer to pay the COBRA for 6 months, which is a nice thing on the one hand to have that benefit as you're going through the transition. But on the other hand, it can make things tricky, because if you're getting your COBRA paid for a certain number of months, it would make sense to take it then. But ideally, you'd then like to be able to go into the marketplace rather than having to pay that full price COBRA for the remainder of the 18 months. And prior to this rule change, that wasn't allowed. Once you started taking COBRA, you had to wait either for an open enrollment period or for the end of your 18 months before you can enroll in the marketplace. And so now there's a rule change that you'll have 60 days from the time you lose your subsidized COBRA to sign up. So somebody who, if you spread the word, if you're talking to a friend a couple weeks from now, find out that they're on COBRA, they're really feeling that pinch of having to pay full price after having the feds pick up the cost for the last 6 months, you can let them know they can come in October, and by virtue of losing their COBRA subsidy, they will be able to sign up for health insurance, for November, for December. But for people who don't have COBRA, for people who just have been waiting to get health insurance, October 1st is the deadline to get 2021 insurance. So I encourage you to call today, or as Zach said, get in touch with an assister in your area.
Thanks, Sean. That helps clarify a lot, and it's as I think Sean eloquently described it. There's a lot of moving pieces here and a lot of complexity to the policy, and what we want to do is try and communicate that to you as clearly as possible, and make sure that these important dates don't pass by without you taking advantage of the opportunity if you need and want to. We talked a little bit about this new kind of special enrollment period for those who are on COBRA currently. And I wonder if there are any questions out there from the people watching right now about the COBRA subsidy in particular before we move on to the next topic. I'm going to pause for a minute while we see if there's any questions.
Yeah, and actually, Zach, while we pause, one question that I know I've heard, obviously not today, but that's come up in some channels, is why somebody on COBRA who's losing their COBRA subsidy might want to stay on COBRA and pay that full cost, and why might somebody want to come over to the marketplace? And while we let people type in their other questions, I'll just speak a little bit to that. And one reason, one consideration for folks that comes down to whenever you change health plans mid-year is whether your deductible, your maximum out-of-pocket costs will change. If what you've been paying for the first 9 months of the year, how they'll be treated when you change your health plans. And I think probably it's a good point here to step back, give a little bit health insurance terminology, health insurance 101. We talked a little bit about premiums. The slide had it before. The premium is your monthly bill that you pay each month to your insurance company, just to have that insurance, to have that protection in case something goes wrong, in case you have an accident, in case you get ill and need treatment. And through all the qualified health plans, through the marketplace, you get things like free preventive care, which are annual visits and other preventive care. You don't have any out-of-pocket costs, but out-of-pocket costs are the other cost configuration when you're doing the math. There's your monthly premium. You pay that each month, as we saw, thanks to the American Rescue Plan. People who are applying their discount are paying a premium that's half as much as it was in the spring, but they continue to pay that each month. The other costs are your out-of-pocket costs, and those are what you pay when you actually go to use healthcare or go to get a prescription. Things like copays, or what you pay toward your deductible for different healthcare benefits, and those costs together with your premium add up to your total costs. So when you're using our plan comparison tool, the plan comparison tool is a great tool for looking ahead. Okay, over the course of the year, this is what this plan is likely to cost me, somebody with the ages and health status of people in my household, but it's annualized. And so when you're looking at changing plans or coming in now for the last quarter of the year, if you're coming over from a COBRA plan, or if you're changing from a small business plan into the marketplace, anytime you change markets that way, your deductible will generally will reset. That means you're starting from zero. So if you're somebody that has members of your household that have had some illnesses or on a lot of prescriptions, and you've had a deductible, and you paid a lot in out-of-pocket costs this spring and met your deductible, and now so now you don't have any out-of-pocket costs. Your insurance is picking up the tab for all your prescriptions and provider visits. You may want to keep your COBRA plan for the last quarter, even if you're paying a higher monthly premium. That might be a nice benefit to not have to pay any out-of-pocket costs if you've already met your deductible or your out-of-pocket maximum. On the other hand, somebody who's really healthy, hasn't gone to the doctor at all, hasn't paid anything toward their deductible, or hasn't paid much toward the deductible, certainly hasn't met it over the first 9 months of the year through your COBRA plan. For you, there's really probably no downside to looking at the marketplace. If you can see you can save a lot of money on your premium by changing over to Vermont Health Connect, and you'll still have that protection of a deductible and out-of-pocket maximum if something goes wrong, although you'll have to pay some out-of-pocket costs to meet it, but you'd also have to be paying those out-of-pocket costs for your COBRA plan. In that case, it's probably a easier decision to end your COBRA plan and start up right away with Vermont Health Connect through the marketplace. Whereas, the other scenario I talked about might make more sense to stay in the COBRA plan, have those lower out-of-pocket costs that you've met for the next couple months. Still, on November 1st, when the 2022 open enrollment starts, you can come over to the marketplace, come to Vermont Health Connect, see what those 2022 plans would cost you, and if it's less than your COBRA would be, maybe you sign up for Vermont Health Connect then starting January 1, so that you have that new deductible, right from the start of the year. You'd be having a new deductible likely with your COBRA plan anyhow. So those are a couple of, I think, decisions that go into whether somebody may want to end their COBRA now in September when their federal subsidy is going away, versus holding on to it for a few more months and starting with Vermont Health Connect in the new year.
Thanks, Sean. And as you were talking, one of the things that I thought would probably be useful just to clarify is the concept of start dates, actually, because I think that I know it's a lot of information, and just thinking about the difference in a start date for a special enrollment period versus the open enrollment that you referenced starting November 1st. I know that open enrollment generally, is for that plan year. If you apply during open enrollment or you make a change during open enrollment, generally, depending on the time you apply, it would apply to the first day of the new year. Whereas with the special enrollment periods, whether it be through the COVID special enrollment period that ends October 1st or the COBRA special enrollment period, the start dates may be different. And I understand that sometimes you have a choice and sometimes you don't have a choice, and it does depend on kind of when, in some cases, when you are deciding to enroll. So how should our kind of viewers and our customers be thinking about start dates when it comes to this stuff?
Yeah, thanks, Zach. That's a great question. You're absolutely right. With open enrollment, it is more of a lead time. You can jump in right on November 1st and be all ready for January 1st of the next year with that lead time, but you have that time to wait. In the case of what we're talking about now with these special enrollment periods, folks can go to vermonthealthconnect.gov, look at reporting changes, and there's a whole chart on qualifying events, special enrollment periods that have different rules as far as when you would have to apply and enroll and when they would take effect. But at least for the main ones we're talking about here, people who are ending their COBRA coverage and signing up, people who don't have any health insurance at all and are just coming in through the COVID special enrollment period, as well as people who were direct enrolled with either Blue Cross, Blue Shield of Vermont, or MVP Healthcare. They want to transfer their plan over to the marketplace so that they can take advantage of these lower costs, these tax credits under the American Rescue Plan. In all of those cases, people can come in through the end of the month, and as long as you come in by the last day of the month, your insurance will start the first day of the next month, and that's generally how these work. And I should make that final point that there's a one-day exception this month when we talk about October 1st. Normally with these special enrollment periods, it would be you come in by the last day of the month, so you come in by September 30th, and you would start October 1st. But October 1st is the one day that there's kind of the one-day exception. That's the final day of this special enrollment period, the COVID special enrollment period. And so people who come in on October 1st, 2021, will have their plan start that same day, October 1st, 2021. So that's kind of the exception, not the rule. But as the last day of this special enrollment period, that's how it works that way. But again, no reason to wait till the 1st. You can call tomorrow or or Friday and get a jump on it.
Thanks, Sean. Appreciate the clarification on that. And one other piece that I'm thinking may be helpful to share with Vermonters is that when you apply through these special enrollment periods, the coverage time, and you alluded to this, I think, when you were talking about, you know, what costs carry over from one plan to another, but the coverage time would only be to the end of this calendar year. And then so it would actually be important for folks to, if they were going to apply during one of the special enrollment periods, yes, go ahead and do that as soon as possible, but then keep an eye out for open enrollment and make sure that you also apply for your coverage starting in January, because if you just apply during the special enrollment period, it will only take you to December 31st and won't take you past that. Is that right?
Yeah, well, I think people who enroll through a special enrollment period with Vermont Health Connect, and they start, so say they, you know, sign up today, or say they sign up October 1st and start October 1st, as long as they keep paying their monthly premium, their plan will renew into 2022. So you don't need to necessarily sign up again or fill out an application again in 2022 if you sign up through the marketplace now through the special enrollment period. You just have to keep paying your bill. Now, having said that, we highly encourage people to look at the plan comparison tool and compare their options, because premiums do change for you know, for the new year, for 2022, and you can look to see, you know, again, check the health status, check the provider networks, the prescriptions that are covered from each insurance company. But if you sign up during the special enrollment period, you will get that information in the mail. You'll continue to get your bill. One big change that people will see, which you'll be hearing a lot about later in the fall, is that starting in 2022, those premium payments, the bills, will be coming from the insurance companies. People won't have to pay Vermont Health Connect anymore to be kind of the middleman on the funds. They'll get the bill right from their insurance company. They'll pay their insurance company. But to get these lower costs, you do have to enroll through Vermont Health Connect, not through your insurance company. And so, yeah, I think, as you say, Zach, that's kind of a key point for people who do come through the special enrollment period. You know, they'll be able to seamlessly go right into their 2022 health insurance. Although, as you say, their deductibles will start over on January 1st. That's the same, you know, across the state, in the marketplace, and outside of it, that the plan year follows the calendar year. And again, where that, you know, may come into play is if somebody has a health insurance plan outside of the marketplace right now, that's not, you know, it's not an individual plan through the insurance company. Because if you have an individual plan through an insurance company, that's not a reason not to transfer over your plan, because your deductible and out-of-pocket costs will transfer over if you're coming from Blue Cross or coming from MVP in their individual plan. But if you're in a COBRA plan, or you're in another plan that's outside of the individual marketplace, that's one where you'd want to pay attention to that plan year, to what your costs have been. And in those cases, I think that's what you were alluding to, Zach. Somebody that might make that decision now, it makes sense for me to stay on COBRA because I've met my deductible. But again, you know, with your COBRA plan, with those plans, those costs are going to be resetting in the new year as well. So if you make that decision, you will want to come back and compare costs. And during open enrollment, you can come back and sign up for a marketplace plan that will start January 1st, and then you can cancel your COBRA plan effective the end of December rather than effective the end of September, if that works for you.
Got it. Thanks for that clarification. Lot for folks to think about. Sean, are there other things? So I know you gave a little bit of a sneak peek at some of the things coming down the pipe beyond the special enrollment periods as it relates to the premium, the premium payments going directly to the carriers, and also obviously we talked about our open enrollment period. Are there other things that folks need to be thinking about as it relates to, you know, us coming up on the 1st of October?
Yeah, you know, I think those are really the big things, I think, for, you know, for folks themselves when you're evaluating your plan. I'd say the big considerations would be what your costs are going to be. You can see that through the plan comparison tool. What your out-of-pocket, you know, costs are come into play there, as we've discussed. Thinking about if you had, you know, left Vermont Health Connect or had enrolled directly with an insurance company because you know, didn't want to deal with the bills or paying the checks, you wanted to pay it right to the insurance company. As we've said, fortunately, that won't be an issue or distinction in a few months. So I think those are really the big things for individuals and families to consider. Beyond that, I think we'd put out there, as we've talked about at some of the other town halls, is thinking beyond our own families. And one of the reasons Vermont has been able to achieve one of the lowest uninsured rates in the whole country is because the community fabric of Vermont is so strong. People really do look out for their neighbors, you know, for their cousins, for their friends, for their coworkers, and spread the word. And that's something that we've seen, you know, in the household health insurance survey, is repeatedly that people say that people who don't have health insurance, only about just over 3% of Vermonters, fewer than 20,000 people in the last one. But most of those people who didn't have health insurance said the cost was the main reason they didn't have health insurance, that otherwise they'd want to have it. And so to the extent that we can get the word out, you know, to our coworkers that don't have insurance, to our friends, to our family members that don't have health insurance, to let them know, you know, look, before you said you don't have health insurance because it costs too much, you really need to take another look. You know, go take a look at the plan comparison tool, see what the health insurance would cost you. We've talked about, for people, we gave the example before, people that applied their subsidies paying half as much, you know, as they had before. We're looking at people who had, we talked about that cliff going away. It used to be people that earned just over $50,000 as an individual didn't, you know, get any subsidy. It would cost them a lot of money to get an individual plan, even the lowest cost plan. You know, now they can get that lowest cost plan for under $200, about $190, which was, you know, less than half what they had been paying, or would have had to pay before if they wanted to get the lowest cost plan. So the more we can spread the word about that, and I know, you know, you help put together the tools and the toolkit too, Zach. If you want to, you know, speak to what people can find there at all, but I'd put that out if people aren't sure how to spread the word or what details to share with their friends who might not have health insurance beyond that key date, that October 1st date we're trying to drive home. Maybe you can speak to some of what they can find there in the toolkit.
Absolutely. Yeah. Thanks, Sean. And appreciate you kind of putting this in the broader context. You know, and the other thing I just wanted to mention, because I think a lot of people do know this, but there are those who don't, is that there's all kinds of benefits regardless of the plan you select that will be covered, you know, regardless of the plan you select. And Sean, you can probably touch in more detail on just some examples of that, but there are folks now who will be receiving, you know, like Sean mentioned, almost a zero cost plan, and are still entitled to those essential health benefits, which is really important for people to understand. And so just to kind of piggyback on what Sean's saying in terms of us communicating that out to Vermonters and all the you know, families and friends that we know might want to consider this information, we've put on our website a variety of different types of tools and information pages where people can learn more about that. So if people are more interested in watching videos, watching the past 4 town halls, and this one will be posted, so we'll have 5 town halls where people can listen to us talk about this and hear some of the answers to questions. They can go on our website and find the town hall videos there. There's also a very general kind of informational video about the subsidies, the enhanced subsidies, the additional cost savings that people will be, many people will be entitled to from the American Rescue Plan Act. And if you're an organization, there are social media posts that, or an individual for that matter, that you can share to try and get the word out. And, you know, basically we want to lead as many people to this information as possible. So, you know, I think, like you said, Sean, you know, the high level message is, if you have looked before, or if you haven't, but if you looked before and you thought it was expensive, you know, please look again, because there is this coverage out there that may be much more affordable for you, and may cover you in ways that you thought you couldn't be covered before. So, Sean, I don't know if there's anything else you want to touch on to send us out, but we don't have any more questions tonight, and I think that we've covered COBRA pretty well. And again, this video will be posted, but Sean, any last thoughts?
Yeah, I mean, the last thing I'd say, just on that note of helping spread the word, if you have people have questions, we are going to be back here in 2 weeks, right? September 29th, which will be just a couple days before that October 1st deadline. So if you know of anybody who's, you know, been thinking about it, or saying they'd get around to it, but like to be procrastinators and wait to write to the deadline, then we'll be there to talk to them on Wednesday the 29th, and people can answer, you know, submit their questions ahead of time, and we'll be happy to speak to those questions and help people get enrolled, you know, by the October 1st deadline.
Great, thanks, Sean, and I want to thank everyone for watching tonight and tuning in, and this again will be recorded, so you can share this as you wish. And until next time on the 29th, thank you very much. Thanks, Sean, for joining us, and have a good night.
Great. Thank you.